Good morning and welcome everyone to the Spokane Regional Crisis Collaborative meeting. I'm Kalen Roy with the Spokane County Regional Behavioral Health ASO, and I'll be facilitating today. For anyone that is new to this meeting, just a quick overview of the purpose of the SRCC. This meeting is held on a quarterly basis and allows for local stakeholders, community members, treatment providers, managed care organizations, law enforcement, tribes, and other emergency services to come together and discuss all topics related to our behavioral health crisis system, which covers our BHASO 6-county regions: Spokane, Adams, Pend Oreille, Stevens, Ferry, and Lincoln counties. Additionally, it provides the opportunity to share information on new programs, identify any challenges or trends, and develop solutions for common goals throughout our region. So for attendance today, I'm just going to ask that everyone put their name, title, and agency in the group chat. That way we can keep track of who was in attendance today. And just a reminder, if you're not intending to speak, please keep yourself on mute so we don't get any unwanted side conversation or feedback. And with that, we will go ahead and jump into our first agenda item. We have Jessica Thompson, Integrated Behavioral Health Quality Supervisor, the ASO, to share about the REACH program. So Jessica, I will turn it over to you.
Thank you, Kalen. Okay, am I able to share my screen? Thank you. Let me bring my presentation up. Get everything all organized here. Just one second. So good morning, everyone. As Kalen shared, my name is Jessica Thompson. I'm an Integrated Behavioral Healthcare Quality Supervisor here at the Spokane County ASO, and I provide oversight for our program side of our division. And I'm here today to talk to you a little bit about the resource engagement for adolescents and children, known as the REACH program within our region. So I'm going to start with just a generalized, this is the mission of the REACH program. I'm not going to read it verbatim. I know that you guys will all get the slides after this, or if you haven't already. But the mission of the REACH program is to create a safe, welcoming, equitable, and valued resource for youth and families in need of support and connection to behavioral health resources and other community resources as needed. This sets the tone for the program, and I will go into a little bit more detail about what this program looks like. The population served by the REACH program. So REACH services are provided to any youth of all ages, with the goal population being more that K through 12 age range, but we do serve youth that are older and a little bit older than that if they are still in school. We also provide services regardless of insurance. So this is not an insurance-based dependent program, and youth and families never receive a bill for any of these services. There are two main priority populations that are the focus of the REACH program. And the first one being youth with complex behavioral health needs that are currently residing in emergency departments or other community inpatient settings that no longer need that level of care, but there's challenges in finding alternative solutions or additional services so they can remain in the community. The secondary population, and this is the area in which we see more of our individuals at this point in time, are just any youth with complex behavioral health needs requiring assistance and connection to additional behavioral health resources and community supports. So the REACH program has three components. I like to break this down to make it a little bit more simple because there's a lot to this program. The first being resource navigation and connection. We also have multi-system team meetings that bring together professionals from a wide range of disciplines to come together and staff some challenging cases, and I'll get more into what that looks like. And then the third aspect of our program is the steering committee meetings that seek to make change and identify gaps at more of a regional level. So first, I'm going to speak about the resource navigation piece. This is the piece of the program that's kind of the nuts and bolts of the program and where we do most of the work with our families and where most of our referrals lie at this time. So we meet with the youth and families once we receive a referral, and I'll talk a little bit more about that later in the presentation about what a referral looks like and how you can make one. So once a family is referred to the program, my REACH team will meet with the youth and family and identify what resources and services supports are needed. And this is accomplished by providing education on what resources are available to meet those needs. So they identify a need and we share what resources can meet those needs. And then we support the family in making referrals to the resources and services that they feel is best for their situation. We work to provide warm handoffs to the services and supports identified by the family and by the REACH team. And then we also do provide follow-up on the effectiveness of those resources and if any additional supports are needed. And so we don't just connect them to resources and say this is the end. We also provide that ongoing follow-up and to make sure that all the resources that we did identify and they did seek are meeting the family's needs. I'm going to quickly pause. Any questions on resource navigation? Not hearing any. I'm going to keep moving through. So the next aspect of our program, as I shared before, are multi-system team meetings. And these meetings are requested by youth and families who are in need of additional resources and supports to meet their identified needs. These meetings are comprised of a core group of professionals made up from various disciplines. And I will share a little bit more about what that, what the makeup of the multi-system team committees are in the next slide. But we come together to collaborate and make appropriate recommendations for services at the time of the meeting. And MSTs currently are held weekly on Thursdays at 11 a.m. As I shared, the multi-system team membership is made up of a wide variety of different professionals, ranging from schools, behavioral health crisis response, emergency departments, behavioral health providers, autism specialists, social support providers, tribal affiliated agencies, community and youth peer-led organizations, managed care organizations, developmental disabilities, Department of Children, Youth and Families, and there are other participants within this meeting as well. And what does an MST look like? They're held virtually again that Thursdays at 11 on a weekly basis as needed. We cancel those if they are not needed for that week. But they're held virtually for 90 minutes. The referent or the family will provide a brief history of what's going on and their concerns and a little bit of background. The MST members then have the opportunity to ask any clarifying questions to ensure that their recommendations are appropriate and beneficial for the situation of the family. MST members will then make recommendations based on the needs of the family. And the facilitator of the MST, which is myself currently, will document the recommendations, provide follow-up with the youth and family to ensure that they are connected with those recommendations that they choose and that they think will be most beneficial for their situation. Any questions on the multi-system team meeting before I go to the last aspect of our program, and then we can talk about referrals and what that looks like. All right, not hearing any. So the third aspect is our steering committee meetings, and these are quarterly meetings that are held to provide not only updates on the REACH program and any trends that are identified through our work, but also they include partners from various professions similar to the MST meetings. And we work together as a region to identify any trends and gaps in youth behavioral health services. We also work to identify solutions to the identified regional needs, provide updates. We create some action items that we can work together as a region to see if we can make any, we can help support any gaps that we are seeing as a region and work together to do that. And to ultimately better serve youth and families within our region. So how do you make a referral to the REACH program? We have a couple different mechanisms for that. We do have our website and where all you have to do is click on the referrals and then a online like kind of portal. You can enter in information and then just hit submit and our team will get that information. You can make a referral that way. You're also always welcome to reach out to the REACH email that's listed here or myself if you would like to make any referrals. My phone number is also here on this slide available to you if you want to call and ask staff if a case is a good fit for REACH or if you have any questions or concerns about the program, anything that comes up. I'm available for that as well. So we try to make the referral process as easy as possible. And again, this is for youth of all ages, regardless of insurance, and they will not get any bills or anything, with the goal of resource connection, ensuring that we are able to provide the services this family needs, instead of having that revolving door going through the hospital system or the jail system. And then these are the members that make up the REACH team currently. I am the supervisor of many programs, REACH included, so my information is listed there. We also have a case manager, and her name is Taryn Kovac. And then we also have our peer support specialist slash navigator, who is Serena Lewis. They are very great at their jobs. They're very knowledgeable about resources, and are happy to help and answer any questions. And I think I went potentially a little bit over my time limit, so I'm going to pause there and see if there are any questions about the REACH program or anything I can answer. All right, I'm not hearing any, so I'm going to stop sharing. And Kaylin, I'm going to turn it back to you. The sun's coming in my office in a weird way. Sorry about that.
No worries. Thank you, Jessica. Didn't see any questions in the chat either. So if anybody does have any questions, feel free to reach out to Jessica, Taryn, or Serena regarding REACH. We will move to our next agenda item. We have got Ashley McGee, Integrated Behavioral Health Manager with the Spokane County Regional BHASO, to give some updates for the ASO. Ashley, over to you.
Thank you, Kaylin, and good morning, everyone. Thank you for being here today. We had another presentation scheduled for this time slot, but they unfortunately had some last minute cancellations. So I thought great opportunity for me to be able to jump in and talk about some updates as it pertains to our crisis system of care in the Spokane region. So there's a few different things that we're taking a look at and working towards moving forward into the new year. One of the bigger ones that I wanted to discuss here today is in relation to RCL and 988. Department of Health and the Healthcare Authority have put out a joint policy statement regarding the future state of 988 and RCL, recognizing that they both have very valuable places within our system of care in the state of Washington, and how they envision that operation to work in the future as they are working towards that goal. And that's really with making 988 kind of that entry point for individuals seeking assistance, seeking care, and having the RCL be more specific to those regional professionals and supports needing to get in contact with those crisis system supports as well. Again, recognizing that both have a very unique and important role to play, especially in our regional approach. We are very unique in the Spokane region in the fact that we have one provider that operates both our 988 and our RCL, and that's Frontier Behavioral Health, which puts us in a very unique position to have this vertical integration. And so for the last 2 years, the BHASO has been working with leadership to really kind of identify how we can make processes streamlined and more efficient, while having similar resources and ensuring duplication isn't occurring. And we can be strategic about leveraging those to make sure that the care is being received within our communities. And so in partnership with Frontier Behavioral Health, we are looking to build out what our long title is a crisis response triage and mobile dispatch coordination unit. But for the ease of not having to say that every single time we're talking about it, MDU, mobile dispatch unit. And so I do want to say that this has no impact or no change on how people access crisis services at this point in time. They can call 988, they can call the regional crisis line, and they will still receive and continue to receive the responses that they have traditionally received. What this unit is hoping to do is to better streamline those processes for response across our region. And so once it's identified that an individual needs a response, an in-person response, it would still be dispatched through 988 or the RCL to this unit, who will then be able to more appropriately dispatch to those teams, whether that be one of our crisis teams in one of our other counties, in one of our 6 counties, or whether that be connecting them with one of the unique child, youth, and family teams specific to maybe just Spokane County, but really trying to streamline that process and be more efficient in the way that our resources are utilized, especially with our uniqueness. Again, this should not have any impact on the way that you access these services, but it is something we're working to put into place and kind of in a tiered approach to ensure that we can work through any challenges and that there's no impact to service provision for individuals in our regional service area. And I'll pause here to see if there's any questions about that. Not seeing or hearing any. And so a few other key points that I wanted to touch upon when it comes to our crisis system of care is the state is taking a look right now and putting out information regarding endorsed mobile rapid response crisis teams and community-based crisis teams. And this is in correlation with some of the statutes that have come out as it relates to 988 for teams to be able to urgently dispatch to behavioral health crises in the field based off of 988 calls. And the state is working on that. I think there's still a lot of work that is happening on that end. I don't have anything to report at this point in time. I know they are putting out those applications for teams to seek endorsement if they would like to pursue that. And the BHASO will be working closely with the state through that application process for any applicants because that would flow through the BHASO onward. Kind of in the same vein of that, in conjunction with the state and with Senate Bill 6251, the Spokane Regional BHASO is also working on a comprehensive regional dispatch protocols. We plan to release this finalized version in July of this upcoming year, but in the process, we are meeting and discussing with our crisis providers about how that dispatch occurs and what that looks like individually to each county, because that looks a little different across our region, and pulling that information back into a more overview of that system. We are working with our crisis providers, and then eventually we do plan on bringing that information to this meeting, our crisis collaborative, to get further stakeholder input on that. And so you will see that as a likely agenda topic for future meetings moving into the new year. Again, it comes from statute and in conjunction with the state to really help provide a picture of what that process looks like across our region and to ensure that individuals and providers alike know how to access those services. I'll pause there to see if there's any questions on those two topics.
I do have a question about 988, Ashley.
Yeah, absolutely.
Can you speak a little bit to what the state or the country level is doing about routing folks to their local providers when they have a phone number that's out of the area?
That's a great question. And I don't know that I can speak specifically to that because that's under DOH. I don't know if we have anyone from Frontier on that would be able to speak on that. Sarah, I saw you had jumped in here. I don't know if you feel comfortable doing so. Regarding
I can do that. Good morning, Ashley. Good morning, everybody. Earlier in around October, the FCC approved for geo-routing, which means that when an individual calls, whether or not they're in a different state, they're going to be routed to the center closest to whichever cell tower they ping off of, which is a great improvement. It used to go just primarily off of area code and the first three numbers. So we've already implemented that, and we're getting individuals just local to Spokane.
Awesome. Thank you for the update on that. I appreciate it.
Sure.
Thank you, Sarah. That's a great update. I know that that's been, I think, an ongoing question with 988, but I know something that they've obviously been working hard to implement. I also see a question in the chat regarding how will this differ from the mobile crisis response program, and I'm not sure if that's related to the endorsed teams or if that's related to the mobile dispatch unit. The mobile dispatch unit, which in Spokane will also have the option and availability to be able to also provide dispatch, will be different, not necessarily significantly, but in the sense that it will be able to communicate more streamlined and efficiently with those providers providing that response, kind of knowing, especially for the Spokane County region, knowing where they are located and who's most available. Again, just streamlining. The endorse teams aren't very different from the current mobile crisis response program. It's just adding an endorsement, and there's certain requirements associated with that 24/7 operation. There's a transportation component, a training component, and there are some incentives for providers to be able to respond in a timely and efficient manner based off the guidelines that were passed down through the legislatures. And so that's kind of some of the key differences. And again, that's in efforts to streamline those responses for dispatch for 988 calls as a part of the state's plan for crisis. So I hope that that answered that question there. If not, feel free to reach out and I'm happy to talk more about that. So some good questions. And lastly, I'll just talk a little bit about some updates regarding, the state's plan is very much centered on having someone to call, someone to respond, and someplace to go. And I just want to talk about some of the efforts that Spokane County specifically is working on as it pertains to someplace to go. We have the Spokane Regional Stabilization Center. They were actually supposed to talk today. We're hoping to have them back at the next Crisis Collaborative to talk a little bit more about their services and how individuals can refer for those services for that regional center that has 3 different levels of care. With that 3 different levels of care, that's often also utilized as a diversion or deflection point for emergency responders as well. But we all know that with the levels of care that they offer, that mental health stabilization, co-occurring residential and withdrawal management, that medical necessity is a component of that and can be challenging to weed through at times where individuals are maybe experiencing more acute crisis. So in conjunction with bills that passed 2 years ago and with opioid settlement funds, Spokane County is looking to build out a crisis relief and sobering center on the same campus as the Regional Stabilization Center. And this falls under the crisis relief bills that passed that allows for 23-hour, 59-minute observation for individuals. So a walk-in access as well as drop-off from emergency responders. And there is some provisions in the statute that allow for transfer from like emergency rooms or hospitals to the center as well, that has behavioral health and some co-located medical supports accessible to individuals experiencing behavioral health crisis to allow them to stay, be assessed, and be provided support for that 23 hours and 59 minutes. And again, that's for that initial assessment and kind of helping an individual stabilize or come up with that next plan and really see what is available there. A good diversion point for law enforcement, for incarceral settings, and as well as for emergency responders and going to an emergency room to receive that behavioral health intervention. And that will be co-located with sobering services as well. We are building that out. That does take some time. And the latest update on that is anticipated completion date early 2027. And so we'll continue to keep you all updated on that. Spokane County is definitely at work with that. And in the meantime, we have began the process of building out sobering and triage services locally with opioid settlement funds as well, to have more immediate access to those needed services. And I will pause here again to see if there's any questions or comments on that end. Not hearing or seeing any. If you do, you can always feel free to reach out to myself or Kaylin or Jessica, who are also involved in this work pretty heavily. We'll continue to provide updates on what that is looking like, and obviously probably our next meeting, bring that regional dispatch protocols document for some continued feedback from our stakeholders here. So thank you all, and I'll pass it back to you, Kaylin.
Thank you, Ashley. All right, our next agenda item, we've got a couple folks from Inland Northwest Behavioral Health, Emily Brower and Jamie Valdez. I'll let you guys introduce yourself and let us know what's going on over at INBH.
Excellent. Thank you. Good morning, everybody. My name is Jamie Valdez. I'm in business development with Inland Northwest Behavioral Health, and then Branches Spokane, our outpatient program. I'll let Emily introduce herself.
Good morning, everyone. My name is Emily Brower. I am the community liaison for Inland Northwest Behavioral Health and Branches Spokane. I've had the pleasure of meeting some of you already, but would love to connect with anyone that I haven't. Just really here to educate the community and just be that good resource and connect with you all. So I'm looking forward to sharing a little bit about what we do.
So we just wanted to stop in and say hello to everyone. I think most people know Inland IMBH. Definitely want to keep this more of a conversation, answer questions. I know that people have had concerns throughout the community with PCCA closing at Sacred Heart, and happy to answer questions around that. I will speak briefly that it's been a pretty smooth process with influx of kids coming to our hospital. We did move the acceptance age from 13 to 12, so we are seeing more 12-year-olds in the hospital. We do have 25 beds, and we can go up to 27. And in fact, we did go up to 27 beds about 2 weeks ago. So we had 27 12 to 17-year-olds in our hospital. We are that crisis stabilization short-term care. And so typically kids are here 5 to 6 days. And we've done a pretty good job of managing that. So we're definitely seeing an increase, but we are able to care for the community. Nothing's ever perfect, but we've been having a steady flow of kids. We have a census of 77 today, and we are a 100-bed hospital serving adults and teens or adolescents now. So about 20 of those beds are filled with adolescents. Are there any questions around what's happening at IMBH with regard to inpatient hospitalization? Perfect. I'll let Emily talk about our outpatient program, and then I wasn't sure if there's anything else that needs to be discussed. We can always meet with you one-on-one. I know everyone's time here is important, so if you have more interest or want a tour, anything like that, feel free to reach out to one of us, but I'll pass it over to Emily.
Thank you. So we briefly mentioned Branches Spokane. That's our group therapy program. We just had an open house last week. We hit our 1-year anniversary of moving off site. So our location is in the Rock Point East building. If anyone's kind of familiar with that area, just about a mile from our hospital. There we do kind of that intensive outpatient group therapy. So that looks like 3 days a week for 3 hours at a time. And then usually for about 90 days. That varies a little bit based off of kind of patient's progress and insurance, but that's kind of the general layout there. We really focus on DBT-based therapy, dialectical behavioral therapy, so building coping skills and learning how to understand your diagnosis and how you can really soothe in your daily life. So within that program, we also do med management. So for folks who maybe are discharging from an inpatient setting, whether that's ours or they're coming from somewhere else, we have the ability to continue that med management through the program. We're really grateful and privileged to be able to do that. Alternatively, in the best case scenario, we're getting ahead of inpatient hospitalization. So folks can enter just through the community. You can self-refer. You can get that referral through a provider or, any other way that it comes to us. We'll schedule you for an assessment. You'll come in and meet our really amazing therapists. They do some really great work there. We've got kind of a full team who's working with the same age range as inpatient. So that looks like 12 through 17 for an adolescent track. That track's going to be after school programming. So we're not pulling our kiddos out of school. Again, that's that 3 days a week. And we also have the ability to do a hybrid model. So if people can't get to us or circumstances change, then we can Zoom in to the program. And then for those adult tracks, same capability for hybrid, a few more times throughout the day and different days of the week to kind of meet different needs of folks, 18 and over for those. And then we also have a couple SUD focused tracks. So I'm really grateful to add that on kind of to our offerings, and hopefully we'll be expanding further in the future as well. Really high level, just kind of some information there. I want to take a pause and see if anyone has any questions. All right. Well, let me think if I missed anything important to add there. Like Jamie said, we're always happy to kind of come by, drop off some helpful information, or have a one-on-one conversation. But thank you all for listening.
Thank you, Emily and Jamie. I think a definitely great topic to have here and bring to the community. I think, Jamie, you hit it right on the head with PCCA closing, knowing what available resources are out there and how IMBH has kind of stepped into that role to help take up that influx of individuals and ensure that critical access to care isn't missed in our community has been greatly appreciated, and being able to speak a little bit more about what that looks like from IMBH's perspective is super helpful for the group. Is there, in terms of, because I know our region accesses IMBH for those services, is there a best way to connect with the team members if there is a youth or adult that is in IMBH from maybe one of our other outlying counties within our region, and they're planning to go back to help so that those teams can work to coordinate effectively what that treatment plan looks like when they return? Is there a recommended method for them to get in contact with?
Good question, thank you. So typically, what the person planning the discharge for a patient is our social work team. They are social workers. They do operate like case managers, and so they're really the ones that meet with the patient after they've been with us about 48 to 72 hours, and they're planning what's next for them when they leave the hospital. So that team is going to be who you want to connect with, and I can share that. We do have a general line that someone can call, but I can also help connect with the social worker. So if you're having a hard time getting a hold of someone or the outlying areas, they can always get a hold of Emily and I, and we can bridge those gaps. But I also can share out the number to call and things like that.
Yeah, that's super helpful. And that's something, if you're comfortable, maybe we can share that general line, and then also yours and Emily's contact information to the group after today's meeting.
I can give some other, handouts of numbers if you need to print those or have those available. So I'll send that as well.
Wonderful. Thank you.
Mm-hmm. And if anything ever comes up in the community, and I know most of the people on this call, but if anything comes up, you have a concern or you want to let me know something great, please let us know, because we're a work in progress. As always, we've been open 6 years, and accepting 12-year-olds is a whole new ballgame for us too. And so if there's areas that we need to learn or you're hearing something, I really welcome those conversations and want to know, because that's how we get better and serve the community better. So just wanted to end with that.
Awesome. Thank you both, Emily and Jamie, for being here today. Exciting news about the rollout of the new branches IOP tracks. Okay, we'll move on to our next agenda item, which is we've got time for any additional walk-on items or other topics people wanted to bring forth. So I will open it up to the group for any provider updates or other questions. Five-second pause, not hearing anything additional that anybody wants to discuss, so we can go ahead and adjourn early, give you some time back. For our next SRCC meeting will be in 2025, shooting for March. So that'll be our next meeting. If there's anybody that you want added to the distribution list from any agencies or from your agency, please reach out and we'll be happy to get them added. And yeah, just want to thank all our presenters today for being here, and we'll go ahead and adjourn. Hope everybody has a wonderful Christmas and holiday season for the rest of 2024. Thanks, everyone.
Thanks, everyone.
Thank you, everyone.
Happy holidays. Thank you.